like to call this meeting to order. Public Safety and Law Enforcement Committee. Do I have a motion to approve the minutes of September 3rd, 2019? Any changes y'all want to make?
Motion approved.
Second.
All in favor?
Aye.
All right, they're approved. All right, discussion items upcoming regarding alternative waste methods and recycling. And that will be the administrator.
It is, yes, sir, and as of the last Law Enforcement Committee meeting, the administrator and staff were directed to research the feasibility of alternative waste recycling, including a dirty MRF and/or incineration process. That research has continued, but I do not have solid information to date for that information, sir.
Okay. The only updates we got the problems over in Pickens and some other counties having problems getting rid of the stuff. The dirty MRF, for practicality, seems like the way we're gonna have to go. That way you tear the bags open, you quit having to tell people to sort things out, we just send it in there. And I think that this committee would so recommend, or maybe John, maybe you and Julia got an idea, we want to direct the administrator to proceed with looking at the dirty MRF more than the other alternatives, or what do you guys think?
Mr. Chairman, if I may, we kind of ran into a week and week because we were so tight on that last one. So I know there's a lot of good research going on, and I've sat down and kind of looked at the stuff that Ms. Brock has done, and I've also reviewed a lot of different things, and I've looked into not only what's going on in the United States, but what's going on in other places that used to haul their garbage out in the ocean and dump it. And it's hard for me to even realize that that was even a method of getting rid of trash. So I think the direction we've given, it just needs a little bit more time. And I know I agree with you, Mr. McCall, that we need to do something. It's time to do something. And I appreciate you continuing to lead the fight in recycling and thinking about waste, because when you don't think about it, it consumes you. And so I just want to, say that publicly to you, that you've continually talked about it. And I think we just need a little bit more time to do that. And I'd like to me, a formal presentation of something like that needs to be, I'd like it to be the entire council, to make a full presentation of that, and maybe we can have, but it will take some time to compile that. Ms. Brock, what do you think would be, your group is doing the research on that. What would you feel like would be an adequate time? Do you think you could have something by, like something good together by November?
I'm thinking the end of November, beginning of December, because remember, a portion of that recommendation for me to do the research was to find appropriate land, a cost estimate for that, a timeline for an educational program, and the cost for two separate types of facilities. That may take a little more. And now the research on the product itself and the recycling program itself can be done quicker. But finding the adequate land would be based upon which of the 2 or 3 models that council chose.
Mr. McCall, if you would see that November 19th is a council meeting, I would like full council to have, and I think, Mr. Root, correct me if I'm wrong, if we involve full council in a call-it-a council meeting, say we start that at 5, and from 5 to 6, this is the item that we're discussing. And then we could close for 15 minutes and come back. How would we proceed with that?
You, Mr. Chairman, if I may, you just noted as a special meeting, all of our regular scheduled meetings are at 6, so you'd have a special meeting to discuss this one item running from 5 to 5:59.
Okay. Well, 5:45, because we need 15 minutes. Can you check with other members of council to ensure, if Mr. McCall, if that's how I would like to proceed, because I think that gives us enough time. And I want everybody here to.
It don't make no difference to me.
But it needs to get done. That's why, we need a timeline, and we need to
Well,
Any-
that-
Committee meetings that day, what do we have?
November the 19th, we do have a real estate and planning and economic. You said November
Well, we can
19th?
we're doing that at 4. We could,
4:30.
my real estate, I don't really have a lot on that, so we could do, if Mr. Kane's okay, do 4:30 to 5. Full called meeting at 5. Or we could change it to 4, correct, if we had to?
You could,
We just need to announce it properly. We'll check Mr. Kane on that. And if that would work, we'd do 4, 5, 6.
Yeah, I agree with you, because I think we need to have a firm timeline like this, and go ahead and educate the full council, and then, determine the path forward. So that we're not just talking about it, we're.
Absolutely, absolutely.
Yeah.
Here's what it is, and go from there. Okay.
And Mr. McCall, Chairman, if I may, the before the end of the year is an ideal timeline, especially since any of the costs associated with doing this facility would need to be implemented in next year's budget. It would give ample time for us to find a financial resource to cover the cost of whichever of the options that council selects. So that's a perfect time.
Strategic planning will start in February, so it would be, we'd all have the knowledge of how we're gonna proceed from there and fund.
Yes, sir.
And we were supposed to have a guest here tonight from Plastics.
No.
Which one of you is AGI?
Neither.
Yeah. He's gonna tell us all about the hot thing he's putting in on recycling the bottles. And he is not here. Aaron, daggone, man, he got a heck of a good idea. And the money to do it with. Okay, moving along. Continued discussion regarding expansion of general health care in Oconee County. I made a slight error. It's not the hospital, it's their billing service that puts the lien on you and turns you over to collection. It's an arm of the hospital. I was wrong saying the hospital, it's their billing service. And they will get blood out of the turnip. And that's what we need to do this, look at this. Ms. Brock, what have you found out on the Thomas Alexander? I got a call from him last week, his secretary, and he's all excited about this thing. He said it's gonna happen. Then I got a call from Carol Baumgartner saying it's gonna happen.
What thing?
Now, I hope you're not talking about the $300,000 grant.
No, I talk about he helped to get the health care going.
Well, actually, I have Miss Vicki Thompson from the Rosa Clark Clinic here, and
Yes.
are you ready?
Yeah, I'm gonna bring the sad news, right?
I'll actually bring the sad news, and then you do the great news, and then together we'll show our new plan, because we have some ideas on how to make improvements, even though Oconee did not get the grant.
Well, we can find another way.
There's always another way, Mr.
Yes,
McCall.
ma'am,
I like it.
absolutely.
And Ms. Brock, if you'll make sure on presentation wise, everything we do, so there's council and camera up there. To me, the best place to do the presentation may be on this way. That way you're kind of within there, or you can start over there and work your way. You can walk the whole room with our new mic system, so.
Yeah.
Appreciate you being here too.
That's very convenient, because I'm gonna need these carbs most likely.
You want somebody to hold them up for you?
No, I'm good.
Just hand them to me. I'll stand, I'll lean over the desk.
Now, wouldn't that make a pretty picture on the camera?
Better looking at me.
Good job, Liz. So, we applied for a new access point grant for Walhalla. And it's a $650,000 grant, which is how Rosa Clark started in January of 2017 as a federally qualified health center. That's how we started with the first access point grant. Oconee County, Walhalla was not one of the selected grantees. A lot of things were at play this time. Puerto Rico got 12 grants, which is highly unusual from HRSA. 2 were awarded to South Carolina, and one of those was to Spartanburg, but the other one was to Foothills in Clemson. And they were awarded one for a new access point in Anderson. Now, we could have competed against them for that grant. The last time we did that, we won because they were competing for this grant in Oconee. But we opted to not go to Anderson. Rosa Clark is an Oconee County health center, and we have always received all of our help and support from the people of Oconee County. And Walhalla has a great need. And Mr. McCall, I agree with you completely that there's a lot of need that's not met. Not yet. So Walhalla just has a bunch of things like you're so much closer to Mountain Rest, Long Creek, Picket Post. There's a pretty large Hispanic community that needs assistance. There's a lot of VAs in the area, veterans that need assistance in the area. So, you know, we really thought out of 120, our score was 98, which is very fundable. So we were excited, and we had every reason to think we would get it. But like I said, it didn't happen. So now we have to look at what can we do. So let me start. Most of y'all know the name Rosa Clark was a nurse practitioner who delivered over 1,000 babies in Oconee County. Started out on horseback, then got a Jeep named Willie Mack. And she delivered those babies as a nurse midwife from 1941 to 1964, and that's where the name Rosa Clark comes from. So we were formed in 1982, and for over 35 years, we were a free clinic. So we were one of the largest free clinics in the state. So whereas in other counties, a health center might refer people to their free clinic, like New Horizons in Greenville would refer people to the Greenville Free Clinic, we are still the free clinic. And by and large, over 70% of our patients are still self-pay, which we used to call free clinic. But because of the local support that we have, we're also different in that 100% of the federal poverty guideline or below don't pay a copay. And the others, up to 200%, pay a very nominal copay. The highest one is $10, and that's if you're like 180% of the federal poverty guidelines, which are only a few of our patients. We now take Medicare, we take Medicaid. The big thing with health centers is health care, mental health care, and dental health care. So y'all were kind enough to vote to let us renovate your building on Oak Street that we always use to become a dental clinic. So Dick Mangrum called right before I came up here and said, it's been a year, where's the dental clinic? And I'm like, well, we're talking about HRSA grants. We have to make sure that everybody in the world knows it's not a historic site. We have to make sure everybody in the world knows that, you know, it's environmentally safe to pick up the tile, and now we've got to abate this and that. So, you know, it's just, there are a lot of hoops to jump through, and there are a lot more hoops to jump through that we never had to as a free clinic. But it's worth it, because along with that $650,000 grant since January 2017, we've received 5 other grants. So we have 2 capital improvement grants, which one is going to expand our leased location on Memorial Drive from the hospital, which we're expanded to become a mental health area, which will have some pain management as an alternative to opioid use, like joint injections and that kind of thing. And then we have now a full-time counselor. Now, the Department of Mental Health does a wonderful job with mental illness, and in the past years, they've gotten more resources than they used to have. But we also provide mental health that they don't provide, like grief counseling, domestic violence, where you're not necessarily looking at mental illness, but you're looking at a need for counseling and mental health services. So we're filling that gap. We believe that the role and the burden on health centers is to fill the gaps, meet the unmet needs. So there are plenty of those, and we have a long way to go, but we have begun the process. We got 3 different grants for mental health, access to mental health services, then substance use disorder, and most recently, integrated behavioral health services, which was a $167,000 recurring grant that we got, but it has to be applied just to mental health and substance use disorder. But in one of these grants, we're doing what's called an MAT program, which is a medication-assisted treatment program with the use of the drug called Suboxone. And 3 of our providers have buprenorphine waivers, which allows them to prescribe it. You have to go through special training, get special certificates. But a lot of people, I like to think of it as maybe the Chantix for opioids, you know. It's that little extra thing that you take that will no longer allow you to get high on an opioid. So some people need that bit of assistance, but it only comes and is prescribed in conjunction with the training, the mental health counseling, rigorous drug testing, and a whole team comes together, the nurse, the case manager, the counselor, the physician, the nurse practitioner, the pharmacist. We have a 340B pharmacy. The hospital is not able to have a 340B pharmacy, but it comes along with being, you get access to that as being a health center. So that allows you to buy medications at really, really low prices. And then if you do get reimbursed for those medications through insurance, you take that money and you build more services. And it's with those funds that we're going to operate the dental clinic. So all of y'all know all about Rosa Clark. You know most of you have either had a family member or a friend or have heard by word of mouth. It really is a community project. It's an Oconee County born and bred thing. And, you know, we want to, that's why we opted to go to Walhalla. We didn't get it this time, but we'll keep applying every grant cycle that offers it so that we can, you know, try to get as much of that federal money into this county as we can if there's a need there. And there certainly is a need in Walhalla. So I don't really know how you want to spend our time here.
Well, I know there was, Mr. Chairman, if I may, just some questions that we have as council on some concerns that were addressed in the last meeting, and maybe you could help. And I know we were talking about how do we help those that can't afford to pay for help. And I think, to me, that's one of the first people I reached out to was man, I said, call Vicki and tell her to come and talk about what you're doing and what you're trying to expand the efforts. And with anything, it takes money. And Mr. McCall brought up a valid point about, you know, these people need help. Some of them don't search out for help. And can you talk a little bit about those that may be weary about walking in to Rosa Clark? So instead of a small issue that they may have at the time, or it becomes a larger issue that they end up at a hospital. So.
Well, it depends on who you're talking about, but let's just say a person who's down on their luck or whatever may not be expecting to have visits by appointment, to be able to get worked in as quickly as we are able to have access to their medication. Still, there are a lot of people who get an $800 a month Social Security check that cannot afford the co-pays to their medication. So they either do without that or food or whatever. With the sliding fee scale, there's not a copay for any kind of medication if you're at 100% or below. So we're able to do things with the help of the federal grant money and requirements that we were not able to do in the past. Like the Hispanic population, some of the people that are undocumented, I have been told, will not come in because we're a federal entity, and they may be concerned about being on record. So, you know, I think our job is to educate that population in the HIPAA laws, that we're really not allowed to tell anything to anybody about anything, you know, so they really don't need to worry about us, but getting them to believe that is a different thing. So there's a lot of need without necessarily a demand. That is just a quiet group that doesn't think that there's another way, whether you're on Social Security, whether you have VA, whether you've got post-traumatic stress disorder and you can't get to Anderson because transportation is such a big problem. So that is what led, Amanda called me the other night and we talked about this, and, and I said to her, if we just had a way to get them to where we are until we can get there, if we just had a van or something. So Amanda goes, I have a van. I have a van. when are you open? Well, we're open Monday through Friday. And so she starts talking about this van, and then how much would it cost to have a driver that, you know, could operate, and it's like a 20-seater?
It's 20 seat, it's ADA compliant. We purchased it at surplus from Senior Solutions. It's been inspected, it's actually wrapped right now. We're using it on game day Saturdays for an airport shuttle. And essentially that van is sitting idle 5 days a week, which would be the 4 days a week that people could be picked up from the Walhalla area and taken to the Rosa Clark Clinic in Seneca. And then the van still be able to be utilized on football Saturdays for transportation to and from the airport to the Clemson games. And it seems a waste to let it sit there when we know there's a need. If people can get to the health clinic in Walhalla, then we can get them that last leg to Rosa Clark Clinic. Nikki and I even brainstormed a little bit about having the van come at a certain time and having a period of time, especially knowing that this population that will be utilizing the services of this van are lacking in a transportation method. So if the van went, say at 9 a.m., and this is all just brainstorming, this is not a set schedule, and gave the client enough time to go to a pharmacy, pick up their prescription, or go by a grocery store, utilizing the in-service that the CAT bus already provides inside the city of Seneca, and Rosa Clark is inside the city limits, and then bringing that shuttle back to Walhalla for that transportation service to be met, we would be killing two birds with one stone and not utilizing any additional county funds other than the amount of fuel and the position for the driver.
I think that's right. I think the big thing that we would find out is there a need? I mean, how many people are gonna get on that van? It's like Amanda said, we'll actually count visits to decide, is this a good idea or is this a bad idea? And, you know, are people gonna use this thing? It's not what we had hoped for. It's not the new Access Point Health Center. However, it gives people access to healthcare that they don't have right now.
Well, you get, when you, since the Mission Act took effect for the VA, you get reimbursement from the VA?
I have no idea. I mean, we have people with VA and they're on our sliding fee scale, but we are not billing.
They're supposed to, under the Mission Act, if you live over
I heard
40
that.
miles, then you, in my case, if I want to go to a regular doctor, I have the option of going to Anderson Clinic, VA,
I had
Or-
heard that.
or else I can go to a regular doctor, providing the doctor is in the VA system. And also, can you apply for U.S. public health funds?
I don't know, as a health center, if we can apply for US, you mean through the Health Resources Service Administration?
In Charleston County, they got the Sea Island Free Clinic. And that started out for the crabbers and shrimpers. And then they expanded it because of a lot of retired doctors living on Hilton Head. And now it's Sea Island Free Clinic.
Right, that's a wonderful operation they have down there, huge. All these retired physicians, but we still have 2 volunteer physicians also. We've got volunteers every day doing some kind of work at Rosa Clark. We still rely on volunteers. But I'm not sure where their funding source is. Most of our grants used to come from, as a free clinic, like Blue Cross Blue Shield, United Way, different places that we no longer are eligible. But the trade-off is good because this federal money more than, makes up for what we were getting. But, as far as the veterans are concerned, we would probably, and I haven't looked into it because we haven't had a big demand. And I think that's what is, I think there's a bigger population in the Walhalla area. And I'm really throwing that out without anything to back it up. But I'm thinking that there might be. Transportation from this area is so difficult for people. Just to get, it might as well be 700 miles, to get to that CAT bus stop for a lot of these people. So that's our real, that's a real problem that we have, and we still don't know where the CAT bus situation is, do we?
No, ma'am. No, ma'am. I am.
So this would be a piecemeal situation. It would be, you know, a bridge to get us from here to here until we can identify other funding sources. But in answer to your question about veterans, what I need to do, and I will do it and get back to you on it, but what we need to do is get our providers credentialed in that system. But we'll have to do that in order to get that reimbursement. And I don't know how many live more than 40 miles from that center in Anderson, in Oconee County. I have no idea, but I can find out probably from the VA office.
And just for the Veterans Affairs Office, and I didn't realize we would be getting to this, or I would have asked one of those staff members to attend as well. But we provide service for veterans every other week to the Veterans Hospital and to private doctor's appointments within the county and outside of this county.
You provide transportation?
Yes, ma'am, we do. We have a van that we use for veteran services.
Wow. Well, that's good. And then, Senior Solutions doesn't come up this far, does it?
They do come this far, but Senior Solutions provides more of the Meals on Wheels and healthcare services with the program that they already operate. I don't know that they go outside.
But we don't turn anybody away who has VA coverage. We just absorb that. We don't have that many. and we absorb
You
it.
should look into
I will look
reimbursement,
into that, yeah.
because if you're a provider, you get a certain amount of reimbursement.
And
But-
that would help us. with
Yeah,
some of these
you
things.
need, this council needs to give you every bit of help we can. Because it's very important what you do. And, it's the basic, one of the basics of providing of the services of county. Law enforcement, public safety, and then health and welfare. So, you're doing a phenomenal job, and this county, this council needs to support you whatever you need.
That's very, very kind. You know, it always has, and because of the great work of the council, I mean, and of the county councils in the years past, ever since 1982, really, it's been involved in Rosa Park. So that is what made us strong enough to compete for the federal money that we now have. So without that, and groups just like this, we wouldn't be in a position to have any of this. But I do believe that at some point in time, you know, we have to kind of get in line for the numbers where the need is. Anderson has the need, there's no question about that. It's just that we feel like there's enough need in Oconee County without us spreading ourselves, you know, out all over the place. It's not about with Rosa Clark, how big can we get? You know, it's about taking care of the people of Oconee County in the best way we can. So I really appreciate you saying that, and I agree with you, there are a lot of unmet needs.
When Joseph Sullivan comes up here, 2 days a month, they are packed, they're slammed from the time they open to the time they close. That tells you the need is there.
Yeah.
And I get so tired of hearing, those darn Mexicans. Well, que este el problem with the Spanish? What is the problem? They're people. They deserve, everybody's a person. Everybody deserves an even health care. Whether you're here undocumented or not. Why you're here undocumented? Must be because they're jobs. Go figure.
Well, some of these people are coming from some pretty violent situations, and, you know,
Absolutely.
I thank God I wasn't born there, you know, or I would probably be one of them, you know, so, but the problem is that you have children who sometimes have to stay home from school because they can't get their immunizations because the health department only has a nurse once a week.
Right?
And if we had, you know, the clinic here, we could have taken care of that. We have applied for another grant. It's called the Oral Health Infrastructure Grant, and I don't know if we're gonna get that or not. But it is, it will allow us to have a mobile dental clinic. An out-of-state outfit runs that program now in our school district. So I met with Michael Thorson and explained to him that with our enhanced Medicaid reimbursement from that program, we can operate that dental clinic over there and serve more completely uninsured people. We can help people with Medicare get dentures that need it. we can help do restorations and not just extractions when there's an abscess, you know? Sometimes you just need, and that affects your ability to get a job and a whole lot of other things. And Amanda and I have talked about how we can partner if we got the grant. Now we've got to go back and talk about how can we partner without it? What is it that we have to have, that we need, in order to move forward with this thing? Because there's, the detention center has a healthcare program, you know, I don't know what they do. I know about how much it costs. That may be something that we could partner on. There are other things like this substance abuse program, and I'm a big fan of Christ Central Ministries because I think they're our only residential treatment program in the county. So it's like the law enforcement division, Christ Central Ministries, and Rosa Clark need to partner together for people that are on drugs but are not criminals. You know, they've just been, I don't think they are. I think a lot of them are just facing an addiction, maybe several addictions, but there's another way to treat meth addicts than locking them up. There's a better way than that, I think. So
Absolutely.
that we just have to work towards that, because that's what we're doing right now. That's our only plan. And that's kind of got to be wholly reevaluated. So, you know, at this point, I think we move on without the grant and just continually meet, continually report back to you guys. But yes, there's huge unmet needs out there. Children with immunizations, what are we going to do about that? The OBGYN thing, we were going to partner with Sullivan Center. I had told them, and they were interested in partnering with us, and we were going to hire them however many days they could spare, 2 to 3 days, to come up here and just do the Hispanic population, because they already know them, they know each other, they have a bilingual nurse practitioner, and, you know, it would have just been a perfect match for us. But now we can't afford to hire the Sullivan Center, but they're up here every Friday, actually, but all they're doing now is basically the OBGYN clinic. So,
We got 2 days a month. They got the general clinic on Thursdays.
I don't know that they're still doing
Yes, there's 2 days. It was 4 days. They chopped it down to 2 days.
that a month.
Uh-huh.
I thought they had, we'll check on that and see. But there is a need for them to be here also. You know, and space is a problem.
We got buildings, we got rooms, don't worry about it.
I do like the way you think.
We got sunlit rooms.
You guys.
You don't want those, Vicki. Vicki, you don't want that sunlit room.
Mr. Chairman, if I may just a minute.
Don't want it.
You don't want that room.
Well,
The natural light rooms.
there has to be a way
Oh.
for us to pool all our resources, and because you said Thomas Alexander was excited, he was just calling. You know, I want him to tell him that y'all are more important than he is right now, so. I don't know what he's got on his mind, but I know he wants to help us, and I don't even know how he can. I don't know if he knows how he can, but I know that if he can, he will.
We don't know they're up there, Joseph's up there on Thursdays because my wife's the translator.
Oh, okay, well,
They
you know.
they cut it down to 2 days a month.
So it is still 2 though?
It's
Okay.
2 days, it was 4, now it's 2.
I appreciate you coming, number one. You know, in the last meeting, we kind of talked about what was out there, what the gaps are. There will always be gaps. You know, I think the role of everything we're trying to do is lessen the numbers of people. There will always be homeless, there will always be poverty, there will always be sick. The things that y'all continue to do, and I think the partnerships that we have, and I know we have Prisma Health here that's going to talk a little bit too about partnerships that have created better healthcare across the board. And I think that's really what I want to come out of with this meeting. If we talked about transportation issues, we talked about how do we get more people into care. And I know that was a concern that we talked about, people that are too proud to come forth. And, you know, Rosa Clark's not just for the absolute poverty. It's for the sliding scale. And you talk about the sliding scale. To me, people that are trying to get places in life, healthcare can set you back. Healthcare makes you homeless. Healthcare makes you your quality of life fell. It makes you bankrupt. It makes you, there's a lot of different things that healthcare causes. And unfortunately, when you don't take care of your health, that's a spiral. There can be that point in life. It's not just drugs. Talk about mental health. You've talked about that. Those expansions need to continue to happen here. And I appreciate Mr. McCall bringing that up in the last one because, what are the tools? What can we do? Because you can throw money at a lot of things out there. Money's not necessarily the solution to what we're trying to do and what the mission of Rosa Clark is. We look at the grants, we look at the places, whether it's Walhalla, we talked about that. We have a building. Those buildings require renovation. What does that look like? So I'm glad that first off, you came today to kind of talk about, here's what we have. Here's what we're trying to do to expand, and y'all are doing a great job.
Thank you.
I know personally of people that you've changed their life, and you've made them who they are today. And you never know, when people think about Rosa Clark or when people think about Our Daily Bread or Our Daily Rest, they think, that's just for the poor people, and it's not. It's just for the Hispanic population. No, it's not. It's for everybody, because that one person that comes in there, there's a family with that one person. And to me, you see that. We all see that. We all know that it's not just that one person you're helping, it's an entire family. So
It is, and we're starting some group therapy to help families with people with addictions in their home because it affects their entire family. The entire family becomes dysfunctional.
So I think, Mr. McCall, what my recommendation, I know Mr. Elliott probably wants to speak too, so, is just to have a little bit better lines of communication with Rosa Clark and Oconee County as we continue to move forward, that we know, and she brings programs up. To me, I think that door is open today.
I'm a little more aggressive than you. I want to know what we can do to help her right now.
If I may ask for a motion?
Huh?
If I may ask for a motion?
Yeah. What kind of motion you want to hear?
By October 1st, to direct the administrator to look into the feasibility of hiring a county employee to provide transportation for those in need 4 days a week to the Rosa Clark Clinic in Seneca and related tasks.
Y'all made that motion, but I want to add to it. We need to find out what she needs for funding.
That's not a
Because
motion.
with all these clinics, pain clinics closing, I gotta get my pills. I gotta have my pills right now. These people, it's like she said, it's like having opioid addiction, it's like having poison ivy. Not to be ashamed of it, you're addicted to it. You gotta get help. If you can't get the help, then they'll help themselves to your worldly possessions when your back's turned. So it's better to have her clinic treating these people, getting them off and on the road to success before Mike back there locks them up. So we need to, I would like you to look at motion for you as administrator, look at what kind of funding, work with her, what kind of funding do we have to get this thing off and running?
And Mr. McCall, if I may add to that motion, please, that funding resource would not be available until the 2021 budget year, unless we made a budget amendment as such.
Well, get with her and find out.
I'd be happy to do that.
I would stick with the transportation motion as a transportation motion so it doesn't get confusion.
Well, we gotta have
So
fun.
we
We gotta do something.
well, I agree with that, but the motion is stated is a lot clearer than then you can make
I'd be happy to do that just as a courtesy between me and Vicki.
right, and that's what I think, it's just further research and bringing that back to council, whether it is in the fund of a.
And I believe, based on the number of participants we had in the experimental transportation project, any funding associated with the increase in patients coming from a particular area that lacked the ability to get to the clinic may be resultive after we had, say, 90 days or so. We could actually look at the data and see what this is costing.
If I may, Mr. Chairman and Mr. Davis, the administrator could, as an administrative function, just do a pilot project with Rosa Clark, with Ms. Thompson, and just figure out what the need is. It's really a matter of how many people are going to utilize this service of transportation, what other needs and funding necessities are there. She could do that on her own and without any formal resolution or formal program, bring it back to this committee and say, hey, this is what we've done, this is what it looks like, this is what we need, and then you have the information in place then you could have a formal motion, take it to council as, hey, we want to put this program in place, and you'll know what the dollar need is too. So you wouldn't even need a motion at this point to do it that way.
Sound like a plan.
I personally would rather at least have the transportation motion brought from committee up to council, just because we're changing the reason why we purchased the vehicle.
Well, and
And
I
I
mean,
think it
employment
just-
consideration as well.
I would like that just to be referred up to, if Mr. McCall still stands on
Well,
this.
the VA has drivers available, volunteer drivers. Can they use those?
Well, that's all part of, I mean, I
Mr.
think,
McCall, if I may, the VA doesn't utilize that transportation service 4 days a week because their transportation requests do not necessitate the use of it for 4 days a week. This would be a necessitated 4-day-a-week operation.
and we're referring it to council, so council.
And I could add to that
You
and
can have
say that I'd be
additional stuff
happy
by
to
the
make
time
the
we get
request from the state. Sorry, Senator Alexander, I know he's not here, but we could make the request from the state for additional funding if that was something that the council wished to do as well.
All right, whatever you want to do. I need for you to look at U.S. Public Health. The only person I know at Sea Island, if she's still there, is Ann Edenfield. She's an RN. She may still be there.
Okay.
She does a lot of stuff down there.
And, you know, we're gonna, if we're able to do this, if y'all are kind enough to provide the transportation and we can assess the need, like Mr. Root was saying, then, you know, it looks like it might be able to go to other places than Rosa Clark, like the health department, which offers a lot of services that we don't offer as far as, you know, women's health services. We do a lot of the health screenings and all that. They do more of the birth control methods and we do the SNAP grant assistance, but they do the WIC program. So it could be where it could be useful. And, you know, we're trying to do things that we thought the CAT bus was gonna bring to us. But, you know, so we could start with Rosa Clark and the county van and whoever needs health care and grow something from there. While at the same time studying what buildings you do have and what it would take to bring those up to code.
Is your motion is what Ms. Brock stated, Mr.
Yeah.
McCall? And I've got the second.
All in favor?
Aye.
Okay.
Thank you so much. I
No,
appreciate
thank
it.
you. All right, what else we got?
Mr. McCall, we did have Mr. Hunter Cone from Prisma Health here to talk a little bit about changes with Prisma Health and doctors, and talk a little bit about the financial arrangements. And I think that's important for us all to learn on the changes and everything that they've got, if you'll let him have the floor.
Sure, have it.
Thank you, gentlemen. I appreciate you giving me an opportunity to come down and talk to you. I watched the video of your last meeting, and I have to say I was really excited to hear you have such a robust conversation about healthcare, and to know that you have a deep interest in it because, as you've heard, I mean, no one can tell you more about healthcare in Oconee County than Vicki can. And it is truly a partnership because healthcare is enormous. Like, I know about hospital care. That's one slice of healthcare, but what we know now is that 90% of what affects people's health has nothing to do with what we do delivering healthcare. It has to do with social determinants of care, the economy, jobs, education. So it really, truly takes a huge partnership. So there's more partners we have joining in, the better. The other thing that I thought was really great, Mr. McCall, was your true passion for people who are, you know, less fortunate. And that is what motivates most of us who work in healthcare. You know, all of us, for the most part, have some sort of a healthcare story, every one of us. And that's what motivates us to come to work every day. Vicky's discovering now that she's not just a free clinic and she's also a federally qualified health center. You hear the word federal in that. She's discovering about all the bureaucracy and the red tape and everything else that we have to put up with every day. And what keeps us going is caring for the people who need our help. And a lot of them can't afford to pay for services. As has been discussed here, healthcare has gotten very expensive for a lot of different reasons. And so when we can care for people who have no means to pay, that's what makes us feel good. So we appreciate the opportunity to be here. I'm happy to answer any questions that I can. Like I said, we are just totally focused on being a good partner in the community on as many of those aspects that affect health as possible. So whether that's economic development, we have right now the Center for Family Medicine that's going up on our campus is a multi-million-dollar facility that'll house a residency program to train doctors. We're about to break ground on our emergency department, and that's a $12+ million project. We've got the YMCA under construction on our campus. Those are economic development. I mean, that's a lot of construction, a lot of jobs that are being generated. So we're focused on that, helping to in the wellness area, provide access to recreation, provide access to services that help people stay well. Partnering with folks like Vicki and Rosa Clark. The building that they're in now, it was an administrative office, as Mr. Davis knows, because his wife worked there for a while. There were a lot of people in that building. Well, we had to renovate the old hospital to move all those folks into it, and then we had to renovate the building to turn it back into a clinic, which it was many years ago. I'll just tell you that we spent our entire capital budget for the year on that project because it was that important. We wanted to make sure that Rosa Clark had a good home, and together we looked at the community and realized there was no building of the magnitude that was anywhere near being in shape to be a medical clinic that they could move into. And it was that important to get this FQHC up and running. So we've been proud to partner with them, and they're just doing an incredible job, Vicki and her board. So you've covered a lot of different topics. When I watch the video, I'm happy to delve into any of them. So you just let me know where you want me to go. You did have questions about billing, and it's a pretty dry topic, but I did send our actual policies in. They're all on the website, but I sent them in for you to look at. Everything's in there as far as all the questions that you raised last time. They're all answered. I read the policies. There's 4 documents, and it's very detailed, and they're written in very clear language as far as all that sort of stuff. One area that we haven't touched on a lot is, you've talked about it, is opioids. And I really got an education getting prepared for this meeting about there's really exciting things going on with that you all you're involved in it. There is an Oconee County Opioid Response Task Force right now, and the Sheriff's Department's involved in it, and Emergency Services is involved in it, and a whole lot of other folks. Of course, Rosa Clark and Sullivan Center, all kinds of folks are involved in it. It's a group that's meeting and generating a lot of different programs to address the opioid issue. It's recently gotten up and running. We provide a coordinator. Taylor Beechler is her name, and she works over at the hospital. But they are really starting to produce exciting work around what we need to do to get ahead of this issue, to help the people who are already addicted and then try to prevent additional folks from going down that same road. So I think it'd be great for you to learn about that maybe at a future meeting and bring some of those folks in to hear about that, because it was a huge education for me. I knew it existed, but to actually read about it and what they're doing, it was pretty amazing. Really neat thing that's going on there. So I think as a county, we're making progress on that topic.
One of the largest concerns that I hear out there is doctor shortage and nurse shortage. And I know y'all are doing a lot of different things, a lot of, I was at the groundbreaking to try to help get people interested and stay in there. A lot of people don't do it because of the cost and the time to be a doctor, so they go the nurse route. And it seems to me a lot of them have got out of the nursing because it just was too hard on them. But I've noticed an uptick, from my understanding, with a lot of the universities and technical institutes of getting nurses back into the program. Can you talk a little bit about your expansion and what are y'all are trying to do to keep from having any kind of shortage around here for?
Absolutely. So, I mean, one of the motivations with us joining a larger organization was that we were struggling to have doctors. And if you don't have doctors in a community, your whole healthcare system is going to eventually erode away. And the reason was that we were a struggling rural healthcare system, and the doctors knew that, and they want security. You know, they paid a lot of money to become doctors, and they've got to pay back those loans, and they need to work for an organization that they have confidence in from a financial standpoint. What we've discovered since joining what's now Prisma Health is our recruitment has just gone through the roof of doctors. And what I like facts, right? The folks who work for me will tell you I have charts and graphs and numbers and PowerPoint slides all the time. But what I did to prepare for this meeting is I have a list of all the doctors who were here in 2014, and I actually reviewed it with some council members a couple of years ago, but I went back and pulled that spreadsheet up, and I went through it again. I subtracted every doctor who's left since 2014, and I added every doctor who's come since 2014, and I took the net. So yes, doctors, there are doctors who've left the community or retired, and then we brought in a lot of new doctors. And what I discovered, and I was looking only at the doctors who practice in the community, not in the hospital. So you can make an appointment with them and go to their office. There are 15 additional doctors since 2014 in this community. That may not sound like a lot, but every doctor typically has a panel, what we call a panel, of about 2,000 to 3,000 patients. So when you talk about 15 additional doctors in the community, that's about 30 to plus 40,000 additional people who have access to care in this county. Right now, we are typically able to take new patients within a reasonable amount of time. We have multiple practices that take new patients. We hear from time to time people say they can't get in to see a doctor, and we think what's happening is folks haven't really caught up yet with the fact that we've added so many new ones and they don't know who to call. So I would just encourage them to give us a call. People can call me directly. I put my cell phone number out there all the time. It's 864-973-3941. Anybody's welcome to have it. I like helping people, and we will get you to a doctor.
Well, if a doctor retires from your organization, he or she wouldn't be nothing to hold him back for going to work for Rosa Clark, would it?
Now, that's happened. Yeah,
That has happened.
yeah, absolutely. Nothing at all.
We're members of the National Health Service Corps, which pays those loans back. As a health center, we get that membership too.
Yeah.
So I think that's going to help us recruit in the future. It has one nurse practitioner already. In other words, it'll pay, like with the Suboxone treatment, if you're with a place that'll provide that treatment, you can get up to $100,000 in student loans paid back, which is pretty good. And that goes for a pharmacist, dentist, nurse practitioner. And normally it's $50,000, but they're really upping it to get people, especially in rural areas.
Yeah.
I'm sorry.
No problem. So then you mentioned our Center for Family Medicine. We've had a family medicine residency program for over a decade, but we were only training 5 doctors at any given time. That was the size of the program. Now we'll have all 3 years of that training program. So these are people who've graduated from medical school. They are doctors, and they get 3 additional years of training in family medicine. And we'll be training, once the program is fully up and running, 18 doctors at any given time on our campus. So the first 6 arrive next summer. And so those are doctors who are serving our community while they're here. There's an additional 6 faculty members teaching them in that center who also see patients, and several of them are already here seeing patients. Then when those doctors graduate from the program, of course, our goal is to keep as many as possible here in Oconee County. At some point, we'll probably have as many as we need, and then we can help serve other parts of the upstate. But what we hope, of course, is to keep those doctors in the upstate and in South Carolina. But that's going to be a huge thing for this community, to have a practice with 24 or 25 doctors under one roof. I mean, that's a large practice anywhere you go.
I think when I learn about the healthcare, the changes, the doctors that you're trying to attract is what every county is trying to go after, the youth, that they, you know, that 20, 30-year-old group that everybody's trying to get. And, you know, the baby boomers are in the retirement age right now, so healthcare is the highest need that it probably ever has been. Now, that's just me talking, so, but I could just imagine the amount of people that's in that stage of their life. So it's a great time to be a doctor. And, you know, obviously, we are a huge retirement area in here. People are moving from Asheville to Oconee, and I haven't seen that much in my years of insurance, but here lately, they want a little bit better climate, so they're coming down here. Well, with the last 2 weeks, they may be moving back up to Asheville, but I think that's great what y'all are doing, trying to, you know, give them their first 3 or 4 years here, and they'll call it home. So I appreciate what y'all are doing.
Yeah.
The transition from Prisma over to GHS, I know there's always growing pains, but what have you felt like are the most positive? Because I know several citizens have worried about, you're sending our healthcare to Greenville. All you're gonna do is you're gonna stabilize me and you're gonna send me. What have you felt from your side?
From our side, it's been the exact opposite. Just today, I was at the upstate board meeting for Prisma Health, and the person in charge of Greenville Memorial pulled me aside and said, "How full are you guys today?" Because he was looking for any way to keep patients out of Greenville Memorial because they're totally full. And we actually took 2 patients this week from Greenville Memorial, which is not unusual at all. If folks are from Oconee County or we did transfer them for higher level care and they're stabilized, they come back. And we care for them after that. But what we're seeing, the emergency department project, for example, like I said, it's $12.3 million. Almost certainly, we would not have been in a position to do that project at this point after having built the tower. Possibly, we would have found a way to do it, but that's a huge investment to expand our emergency department to serve more people. The investment in physicians has been enormous, and it's to keep care here in the community. We have new services. We have a vascular lab that we didn't have previously. Those folks came to us and did everything turnkey. They said, "We want to set up vascular services here." The doctors started rotating out here. They brought us the equipment. They trained our staff. So there's been no loss of any service at all that I can think of, not a single one. And behind the scenes, things that people don't necessarily see that I appreciate leading the organization, there's been a huge investment from a capital standpoint in our campus. We're about to start a project with Clemson University where we're going to renovate the 5th floor of our older building, and it'll be a research center with Clemson around what's called engaged aging, keeping older folks at home and healthy for as long as possible. That 5th floor is in the older part of the hospital. The roof over that whole part of the hospital was so old, and it was close to $1 million project to fix it. We couldn't afford to fix it, so that 5th floor was vacant for 10 years with a leaking roof. Well, when we became part of a larger organization, now Prisma Health, the investment was made to repair all those roofs and replace them. So now we can renovate that 5th floor because it's got a good roof over it, and we're going to have this partnership with Clemson that's going to be a great thing for this community, and hopefully will result in some tremendous innovations to help people stay in their homes. But those behind-the-scenes investments and just the nitty-gritty stuff that's needed to run a hospital have been invaluable to us.
I appreciate you coming here today, Mr. McCall. I appreciate, both the speakers that came today. I think it's been a great meeting and an eye-opener to some of the stuff I knew and some of it I didn't know. I appreciate what y'all do because it's obviously a huge need and continuing to grow. So,
Well, I gave you my cell phone number, and seriously, I have it with me 24/7. My job, I'm on call all the time, and never hesitate to contact me if you have a question about anything. I'll always look into it and try to get you an answer.
Anybody else got it? Thank you very much.
Thank you.
What else we got? That was it?
That was it, unless you
If
get
I
any
may,
other.
I just have one thing for the other business before we adjourn. You had asked at the last meeting, Mr. McCall, that we do some research regarding the Viola company that was based in Georgia. It's actually an energy company and not a solid waste company. They do burn pelletized wood, but I don't know that that's something we're in a position to be able to do, and I just wanted to provide this information, and you and I can follow up later to
Well,
discuss how
he
we.
was, see, it was kind of misleading when I talked to him on the phone. He led me to assume that they were just grinding the wood and burning it. I said, well, we could grind for burning, but pelletizing that, you talk about a rotary pressing operation.
Yes, sir,
And
it's
that-
quite more than we
Yeah,
imagined, I
and
believe.
then you gotta buy bonding agent for the pelletizing that's compatible with their furnace. And we can't do that. We could give them the wood, but we can't go out with pelletizing wood. That's way up there.
Okay, I just wanted to make sure
I
that the
appreciate that.
information that you had asked for
All
was
right,
provided
Thank
to
you
you.
for your research. Good turnaround.
Yes, sir.
That's good.
Some
I know
things
we're
you can do
putting, I know we're
relatively
putting a lot on you, and it's like, do this, do that, do this, but,
I can
you know,
do it.
you're doing a good job, and I know we're all
Vicki and I
sitting here.
decided that doing the impossible takes exactly 7 minutes longer.
There you go.
Or
Mr.
the-
Chairman, good meeting, very good meeting, I appreciate it.
John, you awful quiet. What's happening?
Ain't had a chance to say anything.
Talk, John.
No, I think it was very good, and I really enjoyed both Vicki and the presentation that Prisma put together, because I think we've learned a lot, and I think we learned that we've got to partner all together, because Prisma can't do it all, Rosa Clark can't do it all. We've got to do it all working together, and we can make a difference if we all work together.
Now, one other thing we got to talk about is, you and I talked about this in your area. We have some kind of a retirement center, not a retirement center, what do you call it? Assisted living, Daddy. For your area is a big void. You got three big neighborhoods up there? Four? Is it four?
3 or 4, yeah.
Okay, we got an aging population. And we need to see, there's a subdivision up there that flopped. I think it flopped, there ain't nothing happening there. Maybe some of your people could reach out and find somebody that wanted to, because the county can't be in assisted living. I mean,
Right.
that's private.
Right.
But the resources, the land is there, it would be an excellent place for that.
Right, we're losing a lot of people to Greenville when it comes to people having to move to assisted living. I mean, that's where everybody's going is.
But you lose, you're raised, I'm gonna use your neighborhood, you're raised in Kiwi, not raised, but you lived all your life, you got all your friends, you're retired. And then all of a sudden, we just snatch you and uproot you because you can't stay by yourself for health reasons. And if your friends wanna see you, you gotta go to Greenville.
Right, I agree with you. We have a big need for that in Oconee County,
And
absolutely.
we need to, if we can find somebody, we need to work with them and say, what can we do to assist you?
Right,
Or to make things easier. We had, a while back, around about second, third year I was on council, we had an organization was gonna put a health care in. They were gonna pay for the sewer line, all the way down, they said, we ain't want no money, we gonna pay for the whole thing. And we had a certain people, you and I discussed, that fought it tooth and nail, thinking they were gonna never get old. So if you come up with anything, let me know, we'll bend over backwards for you.
sure, thanks.
Anything else?
Motion to adjourn.
So moved. All right.